the Medical Directive. And it's going to tell us what you want us to do if you're on your deathbed, for lack of better terms. First thing I always tell people is that as long as you can make decisions for yourself and be able to communicate those decisions, even if we're doing it through taps or blinks, then the living will is worthless. We're not going to follow it. We're not going to pull the plug on you if you're telling us, don't pull the plug on me. But once that has all ended and you no longer can make decisions for yourself, we're going to look at two different situations. One's the terminal condition, where docs are going to certify you're going to die within 6 months. There's nothing we can do. Terminal cancer tends to be the obvious example in these cases. There's one place that if you initial next to it, you're telling us to remove all treatments other than those needed to keep me comfortable and just let me go as gently as possible. And then there's another place that you can choose to to initial next to that says use any and all life-sustaining treatments available. I don't care the cost. I don't care the time, the pain. I want you to do that. And then frankly, go put me next to Ted Williams's frozen head in Arizona to try to keep me going. So that goes for the terminal condition. It also goes for an irreversible condition. Irreversible conditions are a little more gray area, but they tend to be where somebody is incapacitated because of dementia, Alzheimer's, blunt trauma to the head. Most likely at that point, you're already on a ventilator or a feeding tube, and you're telling us, keep that feeding tube going, keep that ventilator going, or pull the plug and let me go as gently as possible.